do you see in your practice from those patients who come in who have the family support behind them?
Those patients, Ed, they're the ones that tend to come out of this depression the quickest and feeling the best in the shortest time frame. So you need family support, meaning close parents, aunts, in-laws, whatever you have, as well as spouses or partners. That is the group that is going to help bring these patients out of the depression.
What about when the family indicates to you, and I'd be willing to guess that there's a tremendous amount of family members out there who would say this right away, we don't want to get in the way. We know there's a problem here, but they're scared, they're a little fearful. How do you turn that around?
There is a fine line between making the patient feel worse and, you don't want to say the wrong things to the patient. So we actually guide and counsel the family along with the patient so they know where the boundaries are and what trigger words per se to not use. And in other instances, we have done therapy for the patient as an individual as well as counseling for the family so they know how to cope with the patient.
What are some of those trigger words?
You don't want to make them feel inadequate. So you say, you're doing that wrong, or I know how to do it better, or things to that effect. You don't want to make them feel more less than they already feel about themselves.
Is that difficult, or do most people get it when you bring them in?
Most people get it. It's just hard to put into effect. So you're not trying to be mean. You're not trying to say anything derogatory, but you want to make sure that you do say it in the right context so that these patients understand and the family gets it.